under Operation 100 Covid-19 Taskforce. Of course, you are welcome, but before we proceed into our main activity this morning, I'll ask Madam Ruth to start our program with a prayer. Madam Ruth, give us a prayer.
Let us pray. Our gracious Heavenly Father, we thank you for today. We thank you for everything that we are here for. We ask that, Jehovah God, even as we try to supplement the efforts of the government, that you will give us strength, and also that you will give us the resources that is needed to do all the operations that we need to do. We ask that even as we have this press briefing, that you alone, you'll be with us even as we start up to the end. We bless you. In Jesus' name we pray. Amen.
Amen. Thank you, Madam Ruth, for that prayer. It is also imperative that we know the people that are within this place. It's important to know. When you meet, tomorrow we'll also meet as we've met today, but of course, for now, we need to know each other. And I will start with you.
My name is Brian Achoka from Times of Zambia.
Okay. Madam behind there.
Good morning, I'm Claudia from Millennium Radio, TV and Daily Nation.
Okay. Madam.
My name is Ruth Kabamba from Operation 100 COVID-19 Taskforce, Education Sector.
Okay, behind there.
My name is Moachi Amukurakura. I'm also from the Operation 100 COVID Taskforce, the quality team.
Good morning, my name is Nafal from QFM and QTV.
Sharon Kalimbula, Camel TV.
Sally Tembe, General Secretary, Environmental and Public Health Union of Zambia, as well as COVID Operation 100 COVID-19 Taskforce.
Okay, how are you?
Elijah Chifita, Camel TV. Warrington Ngosa, I'm the Vice Chairperson for Operation 100, that was in charge of administration.
I'm Akraj Sanga, Deputy General Secretary Finance from the National Union of Public and Private Educators of Zambia. I'm also a board member in the Operations 100 COVID-19 Task Force.
Of course, as you have seen in front of us, we have our able chairperson, who happens to be Mr. Stwala, is the chairperson of the task force. Mr. Stwala, can you stand up and greet the people?
Okay, morning ladies and gentlemen, thank you so much. You are most welcome to this press briefing. Please feel free even to ask questions after the press briefing. Thank you.
At this point in time, definitely I will even raise the same chairperson to introduce our partner. In this case, is the one who is going to introduce our guest. Chairperson.
Thank you so much, Madam Spokesperson, Mrs. Kampamba. Thank you for hosting us once more. In our midst today, we have Mrs. Mazianga Liwewe, who is coming from Zambia National Public Health Institute. Zambia National Public Health Institute is our partner in the fight against COVID-19.
Madam, you can stand up and greet the people.
Good morning, everyone. It's a pleasure meeting you all. Thank you.
Thank you. Thank you. Let me give a hand for what it's not easy.
Yeah.
It's not easy. She has moved all the way from her premises to this place, meaning she has that heart for this institution and of course the things that we are doing. And of course I will not forget myself, and I'm the last one. I am Kampamba Charity Tembo, and I'm the acting spokesperson for the task force. Thank you so much. I think at this point in time, we'll move into an item to do with the welcoming remarks, and of course I will take that responsibility. The chairperson of Operation 100 COVID-19 Taskforce, Madam Liwewe. Should I simply say all protocols observed? I stand here to simply welcome all of you to this place, and of course to get to know how we've been faring from the time we had launched this task force. And this task force for sure is encompassing the prominent labor movement and of course the people in the public sector who've teamed up, and they are saying their role is to just supplement on the government's effort in the fighting the pandemic, which in this case is Covid-19. With what so far they've done a number of things from the time of the launch to date. But then we are here simply to be updated, but of course it's through our chairperson who will give us what we've done and of course what activities are yet to be met after this press briefing. Once more, ladies and gentlemen, I welcome you. I'm just saying, let us feel free so that we can know what is going to come out from our chairperson, especially to do with the way forward. Because the way forward is important. We should know what we've done during and of course after this press briefing. I welcome you. May God bless you. Thank you. At this point in time, I will call upon our chairperson, who will in turn call upon our guest to, of course, give us a word that we've been waiting for from the time actually we launched our task force. Chairperson, I call upon you.
Okay, thank you so much. Ladies and gentlemen, I'd like to say that the media that is in my presence, the representative from ZNPHR, and all ladies and gentlemen that are present, I'd like to welcome you to this press briefing, and simply all protocols observed. At this point in time, I'd like to call upon the representative from ZNPHI to give us what she has for us. Then we'll move in and give the updates from the task force. Madam Liwewe, please, you can go ahead.
Good morning, everybody. Allow me to write on the protocols observed by our chair. I've already been introduced. I head the Communication Information and Research Cluster at the Zambia National Public Health Institute, and I'm here representing our Director General. He would have loved to be here himself, but he's split with equally important assignments. I just wish to state that the Ministry of Health, and of course, speaking on behalf of the Zambia National Public Health Institute, we are elated to have this partnership formed. We do know that the government stands on a policy of public-private partnership to enhance different activities or responsibilities and assignments in the different sectors. And in the health sector, especially at this time of the pandemic, this partnership is very, very critical and very, very important. And we are excited that you approached us to ensure that we have this partnership and forge ahead in fighting against the COVID-19. The Zambia National Public Health Institute, recently authorized by an act of parliament, is responsible for public health security in the country. What does that mean? We are responsible for ensuring that we know what is going on. So we look for diseases through our surveillance and disease intelligence systems. We are always looking out to see what diseases are going on around the world threatening our public health security, but also within the country. And in that regard, we obviously make our preparedness plans for such eventualities so that we're able to respond timely. So, for example, when we heard that China had this disease outbreak, we already started trying to understand the disease and the implications. And when it started spreading across the borders of China, we knew that we needed to get ready, and we did that. And of course, we have what we call diagnostic systems through the laboratory systems and network to quickly diagnose any case of COVID and see whether or determine whether it's another disease and act accordingly. And so this partnership is important because I see that quality assurance is an important aspect of your institute. I also see that communication, risk communication and community engagement has also been another important agenda on an important item on your agenda. And so I see that there's a lot of areas of collaboration between your organization and the institute, especially in this COVID-19 and any other public health threats and emergencies that may come up going forward. We do note that the COVID-19 is not waning down yet. It's actually still on the high levels. We are at a rate of about 15.3 positivity among the people who we've tested. We've tested over 1 million people in the country, and out of those, 75,000 plus have turned out positive for COVID-19. Of course, you know that this disease presents asymptomatically in the majority of people. And so if somebody hasn't come to the health facility or they're not a known contact to a positive case, then we may miss it. So we may have actually more numbers than 75,000, but the positivity sort of enhances and gives us an idea of actually what is going on. And 50%, I think, for a disease is quite high. We've lost over 1,000 people, more than 500 who have died due to COVID, and others who the SARS-CoV-2, which is the virus that causes COVID, has been found in them. So I think just to strengthen what has been suggested in the partnership, I'd like to emphasize that it is important that everybody recognizes that every individual, every community, and every organization is responsible and has a role to play in the fight against COVID-19. You as an individual should be able to sensitize the people in your household, the people in your workplace, the people in your church place, and so on and so forth. We don't have to wait for somebody else to do the sensitization. We ourselves can be part of that important agenda. We've coined some rules. We call them the 5 golden rules. These are simple rules which, if every one of us adhered to, would probably have controlled the COVID-19 by now. And just to take advantage of the media presence, I'd like to re-emphasize these golden rules. One is to wear a mask every time we are in a public environment or anywhere, even if it's a private setup, but you are more than one person, you should wear a mask. And I'm elated to see that everybody here has their mask on. And I noticed it's not just for this occasion, but even before this press briefing started, you were walking in your masks, and that's very, very impressive. I see that you're good ambassadors. Secondly, wash your hands frequently with soap and water. And if that's not available, there are so many hand sanitizers which you can pop into your pocket, into your handbag, or somewhere in your car, and ensure that you're sanitizing your hands as often, as frequently as possible. The third one is to maintain physical distancing. We advocate that we should have a distance of not less than 1 meter between people. So if you're in a crowded place, you ensure that you are seated or standing in such a way that there's at least a meter's difference between you. Fourthly, avoid crowded places. And we see that this is one of the biggest problems that we've had in the country. When we go to the marketplaces, the malls, we've seen in the bars and things like that, that people are always crowded. And we're saying, please avoid these crowded places. We're being encouraged to use virtual platforms and other innovations to engage with one another. And fourthly, whenever you have any symptoms, we say that please get health advice. So seek medical attention to ensure that it is COVID or not COVID. If it's not COVID, then what is it? Is it malaria? And we treat you as such. Those are very important points. So my call to you is that let us continue to strengthen this partnership and see how we can fight this disease, which is with us for a long time to come, it seems, and prevent a third wave, which may happen if we continue to weaken on our adherence to the public health measures. I thank you.
Thank you so much, Madam Liwewe, for that wonderful and precise speech from ZNPHI. We appreciate you very much for that. And we hand it over to spokesperson.
Another hand. Madam Liwewe, as you've seen us, I'm sure we are more than happy, though you can't see our faces in smiling because of these same masks. We are wearing smiling faces because your language has come out as a true reflection of what Operation 100 COVID-19 Taskforce is really doing, or what it has really embarked on. For instance, you raised the issue of sensitization, and especially to do with workplaces. Workplaces, you find workers there, madam, and in these workplaces, that's where even the three key mother bodies are coming in, namely the ZCTU, COTUs, and of course FFTUZ. These are workplaces, and this is what the task force has really embarked on. There is that sensitization in schools. I'm sure the chair will give an update. Then you also touched the issue of following the 5 golden rules. It is important, and possibly a hand to ourselves, because we are all in golden rule number 1. Thank you so much. And as following the guidelines of COVID-19 in terms of meetings, let me not waste time. I will now call upon our chairperson, who will give us the update and of course the way forward. The chairperson, sir.
Thank you. Thank you so much once more, ladies and gentlemen. Our representative from ZNPHI, the media that is available, the task force members, as well as all ladies and gentlemen available from various institutions. May I just say that all protocols observed. Ladies and gentlemen, we are gathered here to give a briefing on how far we have gone and how far and what we have done from the day that we were launched. We would like to know that we were launched on the 26th of January 2021 this year, and today we gave ourselves a mandate from that day of 26th January 2021 that we shall work tirelessly for 100 days, to complement and supplement government efforts consistently. 100 days. Please mark that one. Today, from 26th to today, we are in day 28. So 28 days have gone. That's more like a quarter of the 100 days. And the 100 days is expiring on the 26th of April. And we've given ourselves an allowance up to 26th of April for purely reporting aspects, so that we can give a final and full report and a detailed report to all our partners that are coming on board. And the stakeholder composition in that regard includes government, which is the first one, and as well as ZNPHI, Ministry of Health, which is also government, and the other various business communities that are trying to assist us in one way or the other financially. Ladies and gentlemen, allow me to delve into the updates of this briefing, which is really aimed at giving us an update from the day that we started to date. Our objectives, dear colleagues, I will drive you through our objectives that are purely a mark of how we could be faring, and we judge ourselves from there. If we are winning or if we are losing on time. Ladies and gentlemen, the main objective of the Operation 100 Task Force COVID-19 is to supplement and support public health responses and efforts to eradicate COVID-19. The specific objectives are to set up and build capacity among health and safety committees in schools, in the shopping malls, correctional facilities, as well as bus terminals. The aim of us setting up these committees, safety committees, we realize that according to Occupational Health and Safety Act of 2010, this is key. The Act stipulates that in every place where there are more than 10 people, there has to be a safety committee. It simply means that wherever there are people, there is likelihood of people being injured whether in body or outside the body. So meaning that there could be some safety precautions that are needed to be taken at each and every place. And somebody must be responsible for taking up that task. The second specific objective is to enhance COVID-19 sensitization and awareness campaigns. We, as a task force, have done quite a number of activities in terms of media sensitization. We have engaged a lot of people a lot of media houses, that is to do with Smart Eagles, has been on our side. ZNBC, we appreciate government for having given us platforms on ZNBC so that we can alert people and sensitize them more and more insofar as the IPC or infection prevention control measures are concerned to the public in order to reduce the spread of the COVID-19 pandemic. We also have taken as our third specific objective in the task force to have an all-encompassing approach, what we call a multi-sectorial and a multi-dimensional approach. This therefore means that in our stakeholder engagement, we have people from various portfolios and various institutions and ministries, because we do believe that as labor movement, we can take up this challenge, but we need the concerted efforts of others, because other institutions equally have their experiences that we can share. Here today we have ZNPHI, the Zambia National Public Health Institute, giving us an update from their end. And we are working together. We are not working in isolation as a team. We are working together with the full cognizance that actual Ministry of Health has and is the custodian of all health matters in this nation. And in that regard, we have formed these safety committees in schools. For Lusaka province, for Lusaka district, we have finished all the 10 zones. All the 10 zones in Lusaka district, and we are moving on to the other epicenters. Mind you, we have our way of operation is aimed and directed at epicenters. That is Livingstone, Lusaka, and Ndola. When we have enough finances with ourselves, we'll spread out these activities to other districts. Then the fourth specific objective is to assess the impact of the current COVID-19 hazard control measures. When we have set these committees in schools, like we have done for Lusaka district, which we are done in the education sector, all the zones have been trained, and implementation has started as well. And the fourth specific objective will be purely to make a follow-up and assess how these safety committees are actually performing and they are doing in terms of implementation of the laid down guidelines in terms of adherence and compliance to the safety guidelines that have been given by the Ministry of Health. Ladies and gentlemen, our campaigns are mainly, as labor movement, our campaigns are mainly anchored on the aspect of trying to protect the economy from falling down. Our campaigns are encouraged by the aspects that are going on in the companies, in the workplaces around the country. As labor movements, we have people and we have workers and the members in various companies And we are concerned that if, as labor movement, we sat and folded our arms and sat akimbo, we shall actually be adding to the levels of ignorance, because we do believe that as labor movement, we've got a certain level of influence. And we, as labor movement, as we speak, we have also a certain level of influence, which we can use to propagate in terms of trying to champion the adherence and compliance level in the places of work. And we looked at the aspects of how best can we stop the aspect of the spread. We are embarking on the aspects of supporting government with technical support. The technical support that we are giving government is purely the formation of these committees, which we have done in Lusaka province. We have trained about 265 teachers across Lusaka district, and all these 265 teachers have formed their safety committees in schools. So, insofar as our operation is concerned, we do not expect any kind of non-compliance and non-adherence in schools. That's the first one. Secondly, the Act of 2010 on occupational health and safety also talks about the aspect of occupational health and safety of not only the learners as it could be in the education sector, but also for the teachers themselves. So the teachers themselves have got to take care of themselves through the trainings that we have given the zones and the SHE committees. And that is why we have taken up this initiative to see to it that we keep the wheels of the economy running in as much as we have COVID in our presence. So we will not stop the economic activities because of COVID. We do not support the aspects of lockdowns, of which all these are remedial measures, which may cause jeopardy into our economy. Possible lockdown can also be a looming one when the cases increase. And also possible declaration of a state of emergency can also be another remedial measure if these cases go up. But as a labor movement, we looked at the aspect of if all these being remedial measures are taken, they could be drastic. Both the people in the formal and the informal sector in terms of employment who actually suffer because they'll be locked down in their homes. So we are training the committees in schools, in markets, in shopping malls, and also in correctional services to ensure that the spread reduces. And even as much as it could be in our midst, we continue to actually run our economy smoothly with proper adherence and compliance levels. Ladies and gentlemen, we also want to appreciate the fact that we have, as a committee, been demystifying the reality of COVID. The demystification of COVID is ongoing through our various IECs that we have put up. We have done massive advertisements. We have done also massive TV programs, not only from the national radio stations, but also from other private media stations, where we have engaged the media stations and have been so cooperative. We want to thank each and every media that is in this presence and also out there for their continued support. And we appeal to them that please, when we knock on your door, do not hesitate to let us in, because we are here for an issue that is above any other matter. Life is at stake, and we all have to take cognizance of this very fact, that we need all to take and play a key role. And that is why our partners from ZNPHI, the Zambia National Public Health Institute, are emphasizing on the 5 golden rules of masking, social distance, sanitizing, and other rules that have been laid down, so that we can see just how best we can reduce the spread of the pandemic. Ladies and gentlemen, allow me to thank the cooperating partners that have come on board for their open arms every time that we call upon them. I would like to thank the PSMD, the PSMD, Mr. Boniface Chimbwa, for having been there for us in terms of support, financially, morally, as well as trying to see just how best, which initiatives we can use to mount up and stop this, this spread. He has also informed and worked with his allies, the other PSs in other provinces and ministries, just for us to have a leeway in trying to see how best we can access machinery to disseminate this information. We thank Mr. Boniface Chumba, the PS, and the entire cabinet for having been there for us, and also the labor movements that are there. Time and again, they are there. ZCT is there, FFT is there, COTUS is there, and we with all these concerted efforts, this is how it should be. This is how it should be. When there is a national issue such as the pandemic, people should come on board. And this is unprecedented that the labor movements, the government, and other private medias and private sector are coming on board for the sole purpose of fighting the pandemic. And so we thank you, dear partners. Please continue. Do not get tired. We'll continue knocking upon your door in each and every way possible that we can have our hands tied together in as much as we are trying to fight the pandemic. The other partner that we'd like to also recognize is DMMU, the Disaster Management and Mitigation Unit. They have provided us with face masks and also the aspect of PPE, which have been coming on board. We thank DMMU for having done that, because very soon we'll be going into an operation that will require a lot of movement and a lot of concerted efforts insofar as curbing the pandemic is concerned. Ministry of Education, Human Rights Commission, market associations, the defense has also been there, and the Zambia Police, RATSA, they are also there, and these are partners that we want to engage in even more in the next operation. Dear ladies and gentlemen, we are so thankful for all these efforts that each and every partner is coming through, and the challenges that we are also facing, and how they are aiming to uplift the task force insofar as championing its agenda is concerned, because for sure this is entirely a national agenda. But all these successes, ladies and gentlemen, have not gone without challenges. The challenges that we are facing right now, one, we have the challenges of finances. Finances, ladies and gentlemen, and the media is here, and the ZMPHI is here. Please, for all those that would like to come in and help us in terms of finances, we have our communication channels that are very clear. We have our accounts committee that is clear. And in the accounts department, we have credible people, even people from the Auditor General, as well as from Zika and also Transparency International Zambia. All these are an indication that when we receive your funds, whoever you may be out there, you are a Zambian, whatever coin you can actually drop by our offices and through the accounts, of course, for easy transparency of accounts, statements, and everything, please do come through and help us so that we can champion, because we are trying to protect the economy. I call upon the business community to come and be part and parcel of this, this great task that we have given ourselves. I also want to extend an invitation to all other forms of stakeholders in terms of the task force. Please do come and be part and parcel so that we have a concerted way of doing things as task forces. All those other various task forces that have been formed in line with the fight against the pandemic. It's high time we came together, joined hands, and see just how best we can collaborate and put our resources together and have a well-documented and a well-organized way in which we can fight the pandemic. So those are some of the challenges in which we have. For those that can manage to give us transport, please do come on board. Transport is a challenge as well, so that we can move from one place to another. As I have already alluded to, we are dealing with epicenters. The epicenters that are on board, that we are dealing with, is Lusaka, Ndola, and Livingstone. In all these places, we will need mobility. We call upon the Ministry of External Supply that they can assist us with some transport that can help us, including the Ministry of Health and also ZMPHI, which is here. Please do come on board, and I'm sure we increase the levels of engagement so that we see how best we can work together in that line. Because the next approach that we have in terms of the operations is purely to carry out what we call a ring formation. We are going to carry out a ring formation in terms of in trying to carry out high-level and robust way of reducing the spread, especially the commuters. Our strategy that we have in the next formation, dear ladies and gentlemen, is basically meant for the commuters. The commuters, we know all of us that COVID doesn't move, but people move. So our next level of approach in terms of operation is basically to carry out a robust IPC operation. Now, this IPC operation that we're going to carry out is going to include the aspect of mounting checkpoints from Livingstone up to Chingola along the line of rail. The operation is meant that at each and every checkpoint, passengers in a bus, passengers in small cars, in trucks, have got to disembark. When they disembark, we sanitize them. After sanitizing, before we even finish the aspect of sanitization, the other team is getting on the track, on the buses, to disinfect. We have realized, and we have a partner now, ZMPHI, which we call Spokio. Spokio is a company that actually is providing an instant disinfectant. It's odorless. It does not choke. You can actually have it disinfected into your vehicle and immediately get on the vehicle and start moving. So purely the second wave is mainly the second mutant is mainly on surfaces. So the aspect of disinfecting is actually very key. So we are targeting, and we will be targeting the aspect of we'll be targeting the commuters at whichever level. And this is the buses. We will target the buses, the small vehicles, as well as the trucks. Day and night. This operation will take place for 2 weeks, consistently. And from Livingstone to Chingola, at each and every main checkpoint, we work with our partners that we have already mentioned here, RATSA, Zambia Police, in the traffic, from traffic section, so that they can assist, and also the defense people from ZNS, as well as Zambia Army and ZAF, at each and every point. Each and every point will mount. DMMU will go on board. Ourselves, the task force, will go on board. ZNPHI will go on board. Ministry of Health will go on board. In case any other person is found with high fever, we quickly isolate. The aim is to make sure that the commuters are actually disinfected at each and every point as they're coming into the main city and as they're leaving from the main city. So this activity will take place for 14 days, for 2 weeks, a fortnight, continuously day and night. And our main aim in doing this is to ensure that we reduce the levels of positivity rate in terms of the spread. So, ladies and gentlemen, again, I would like to ask the the business community to come on board again and see how best we can share with them our estimated budgets so that we can have this operation a successful one. Remind you, dear colleagues, that this virus is actually affecting each and every individual. The business community is affected even much more. Work is even affected even much more. Work hours are reduced automatically from the time that the virus was actually came through. We have actually reported statistically that work productivity has gone low. And our main aim is to uplift the economy through production in terms of work. So, ladies and gentlemen, I'd like to thank you once more again for your attention, the media, ZMPHI, for your participation, and everybody that has come for this press briefing. The business community, government, and all partners out there, we call upon you that let's continue to work together in order for us to curb and stamp down in the crusade, stamp down the pandemic, the COVID-19 disease, so that we can continue running normally once more again. Ladies and gentlemen, I thank you.
A great thanks to our chair and of course our